A core attitude to healthcare is really optimism, and Patrick J. McGovern is quite known for espousing the adage, "The best is yet to come." So, AHIN's advocacy efforts in the recent years has been facilitated through the support of the Patrick J. McGovern Foundation, and we will hear about investing in enabling environments for digital health and artificial intelligence from Rebecca Distler, the strategist for AI, data, and digital health at the Patrick J. McGovern Foundation. Welcome. Thank you, Rebecca, and thank you. Take it away.
Good morning. It is such a pleasure to be joining you virtually. I imagine that this is a common refrain, certainly from me and perhaps from other folks, but just to note that I am so sorry that I cannot be with you physically, but hello from, or good evening, if you will, from New York. I'm thrilled to be here today. The Patrick J. McGovern Foundation has been a really proud partner of AHIN over the last few years, and I joined the foundation just about 16 months ago. And from day one, it's been clear that that partnership has been a pretty extraordinary journey, and it's one that I'm glad to continue on. What I thought I would do with our short amount of time today is to actually take a little bit of a step back and give you a sense of who our organization is, the kind of work we're doing, the kind of things that we're observing around the global digital health ecosystem. And I hope that this is the start of a much larger conversation about our work and a continued path of learning together. So with that, I love that you began with optimism, because that is very much the roots, if you will, of our foundation. So the Patrick J. McGovern Foundation is dedicated to advancing artificial intelligence and data science for public good and social impact. We are very much those optimists. We believe that this technology can and must be part of creating that thriving, equitable, and sustainable future for all. And we do believe that this technology, when designed appropriately, can amplify the very best of our humanity, our creativity, our curiosity, our kindness. These are things that you will hear us talk about, not just in our global digital health work, but in fact, all of the work that we do. One of the things that you will hear us speak quite frequently on is the importance of architecting a shared digital future. And I imagine that this is something that will come up in your conversations, particularly as my colleague was just talking about the importance of digital public infrastructure, for example. But there's sort of four pillars or areas of that work that we really look at. And when we think about what does it mean and how do we go about architecting that shared future? The first is that, particularly as a foundation, we very much focus on strengthening nonprofit impact with technology, artificial intelligence, and data. So a number of our partners are nonprofits and civil society, and I'll talk about them throughout the time here. The second is that we do, as in in our vision and mission statement, we do focus on accelerating applications of AI to maximize human potential. And again, really believe in the power of those tools when designed appropriately for good. Within that, we absolutely look at supporting shared innovation and solutions that address global challenges across a wide range of issues, not just health. And we continue to advocate for digital dignity, data stewardship, and ethical technology. There's kind of three key areas, if you will, of our work. The first is the work that we do around strategic grant making and some of our portfolio focus areas. So we have investments in program areas such as health, which I will do a bit of a deeper dive on for us today. And the second is around climate, so climate change and climate resiliency, climate adaptation. We have a very big emphasis on workforce and education and thinking about the kinds of data skills that workforce, and not just the digital health workforce, though we will talk about that today, but kind of much broadly across sectors. And then, of course, advancing frontiers of ethical and democracy-oriented AI. Some really interesting work in supporting the new kinds of civic institutions that we need to really guard and shape this technology. As shared, a large part of our work is bringing the power of data and AI to that civil sector. So one of the things that we do quite significantly is actually providing direct technical assistance for nonprofits on their data journeys through our cohort-based accelerator programs. And then again, as sort of a foundation, thinking a lot about what is the role what is the role that we can play and what is the role that our partners can play in really leading conversations across public, private, civil society to ensure ethical use of AI and data. And within that, very much look at opportunities to provide a platform for grant partners like AHEN to amplify their work. I'll just give you a little bit of a brief overview of our Data and Society Accelerator program, only so that you know that these programs exist, and that this is sort of a potential pathway for some of the partners you may work with to engage with us in the future. So our Data and Society programs really aim to strengthen nonprofits' technical capabilities and advance data use cultures within social impact organizations around the world. This is very different than a typical kind of grant relationship. They are 9 to 12 month long programs. They're comprised of 10 organizations, very much grounded in that cohort-based learning, and typically around a common theme. You may have seen that our 2022 accelerator program was very much focused on climate action. And so there was a set of organizations that were coming together around a multitude of data-driven solutions in that climate change and climate resiliency space. There's 2 new cohorts that we will are currently the request for, or the proposals have since closed for these, but you will see these launching in 2023. And again, we'll name them because there may be very good opportunities. As one of the things we long admire about AHEN is that peer-to-peer learning, and that's something that these programs will be doing. There was one around data to safeguard human rights. So sets of organizations who are actually looking to integrate cloud computing practices into their work on a range of human rights issues. And then a second cohort that's really going to be focused on data governance. And this is one where nonprofits who are seeking to invest in data governance through a focus on really any of these kind of areas. So data ethics, roles, processes, technology, policies, and security. And so as shared, those are programs that will be launched in 2023. And just a note before we dive into our digital health work, that as an organization, our partners and our work is quite global. We don't have a sort of a geographical restriction. We really look at the partners and the opportunity for impact and where and how our funding and our work together can be catalytic. So what I thought I would do today is to share a little bit about our approach to digital health and some of the learning journey that we've been on really over as shared really pretty significantly over the last 16 months. So I'll begin, and this is a sort of a very streamlined, oversimplified set of observations, but one that I wanted to sort of bring forward to reflect on and again, kind of open up for additional conversation. One of the things that we found as we were engaging with folks in the global digital health space was that our conversations were not always extending to include considerations of artificial intelligence or perhaps more advanced data analytics. And there were a wide range of sort of reasons and very there are reasons behind this, right? We have different countries, communities, systems on various levels of digital maturity who are thinking about other kind of other points of that data journey or that digital transformation. But those conversations, as we were thinking about that digital transformation, were not always extending to include, let's say, the art of the possible, if you will, with artificial intelligence. And then one of the things that we found is that when we were talking to folks who were, quote unquote, in the AI for healthcare for space, or who were thinking about the use of artificial intelligence, particularly, I would say, in medical communities or in academic communities, the things that they were thinking about, the problems that they were trying to solve with AI-driven approaches, didn't always account for fundamental challenges in the ecosystem or the eco-readiness of the systems. And then, of course, something that I think that everyone in this room, in this digital room, the physical room there knows, is that truly the underlying enablers of digital health are critical pillars and are very much the same underlying enablers for advanced analytics and artificial intelligence. And so our question around our work became, what are the things that we can do to channel catalytic investments into enabling environments, those for both digital health systems today and those who are architecting the digital health systems of the future, but also for those future innovations like artificial intelligence. And we were doing this is, again, the building blocks that you all know tremendously well. But when we started to look at some of those underlying building blocks of a digital health ecosystem, we started to apply a couple of different lenses. One was to look at areas where we felt like there was that we're being underfunded. So things that we actually saw in the Global Digital Health Index around sort of challenges in funding and sort of maturity, if you will, around standards and interoperability and workforce in particular. And then we were thinking about, well, what are the areas that we could both channel, again, catalytic funding into that could help support the transformation of digital health systems today, and as shared, sort of prepared for AI, or prepare systems for artificial intelligence and more advanced analytics. And again, that is through the lens through which we began to approach some of this work. And you'll see that I call them learning areas, because these are areas where we are very much continuing to learn from and with partners like AHEN. So I'll give you sort of like a quick walkthrough guide, if you will, of what some of the work in our portfolio has looked like to date. So one of those areas, and you saw this kind of being sort of extracted out from sort of considerations around workforce, right? But how do we help decision makers make better decisions? And so one of the things that we've been very interested in really understanding is that if we want data and AI innovations to achieve their intended impact, we need to ensure that there's a culture of data use that they get introduced into, so that, you know, when we start to think about the introduction of an AI-enabled risk score, for example, that there's someone who knows how to take a decision with that. And we really broadened the aperture on that, right? How do we help folks from policymakers down to community health workers in making those decisions? One of the things that I think has emerged is certainly a community of practice like AHEN. The work that you do to support governments in making decisions, technologists, digital health practitioners, there's any number of sets of decisions. And I should share within that, we are also supporters of DORCANSA, which is sort of the digital health network across Latin America, and as well as the Global Digital Health Network. We've been supporting the redesign of the Global Digital Health Index for a similar reason, thinking about the kinds of frameworks and the tools that help folks make decisions about data and digital tools. And then you've may seen, and I think folks in this room, mindful of time, so I'll move a little bit faster. Folks may have seen that or have been engaged on the Digital Health Applied Leadership Program, which is also something that our foundation has supported. That second learning area, if you will, has really been around the data systems themselves. What are the things that we can do or support our partners in building data systems that are inclusive, responsive, and resilient? And for us, that goes into this question of what makes a useful data system, particularly in health, and thinking about the deep fragmentation that, again, the folks in this room know all too well, and really sort of aligning around kind of three areas that we've been exploring on how can we, again, channel greater investments into this. So around standards, interoperability, and governance, which I know technically kind of goes a little bit into that policy bucket, but we're very much thinking about it in the context of that useful data system lens. And so this includes some of the work, for example, we've supported with ONAM, which is the technical steward around Open SRP, and the work that they've done to help develop open source FHIR-enabled or FHIR-native mobile data collection applications. This is some of the work that we've supported GEMBI around to kind of just direct support for, the example, Open HIE, and the work that they've done to kind of strengthen and enhance that platform. And then with partners in D-Trees, actually an example from Tanzania, and the work that they're doing around helping sort of the government navigate and create a data governance policy and framework, particularly as it relates to their community health data. And then that third platform is really bringing us back to that kind of broader vision around how do we advance AI for public good, and particularly in a healthcare context. So what are the sort of products that excuse me, the products that can really become platforms for systemic change? And I think particularly within this, thinking about how do we support collaborative pathways for both adopting and deploying AI in low resource settings. So some of this has been some exploratory innovation funding. Cushy Baby is an example of this, based in India, a strong partnership with the Rajasthan government, building an integrated community health information program, and then using the data that is being built from that to develop, for example, those risk scores. Another example of this would be sort of the work that we're supporting with Population Services International in Vietnam, that is sort of combining their location services provider platform with technology from Babylon Health, to really explore how can AI-enabled solutions help extend health systems, and how can for example, in this case, thinking a little bit about as we move toward more models of self-care, or as we think about the power of AI and digital tools to help support self-care, how do we ensure that we're still connecting patients and people into health systems and ensuring that as we help folks manage that health, we know where and how to signpost them into trusted and high quality care. So I'll end with a couple, and I'm mindful that I'm coming up right on time, but I'll end with a couple of our sort of the principles that we're trying to put into practice. So one of the things that we try to do in all of our work is ensure that we're putting people and communities at the center of interventions. That is critical. Digital health interventions, that becomes absolutely essential when we start to think about more advanced approaches like artificial intelligence. And I think and within that, we strive to support those who sit closest to the challenges. I'll bring it back again. I think it's something we admire deeply about the work of AHEN, the folks in this room who sit with government partners day in and day out, who are government partners. I know that we've got a whole host of folks in this room. Those who sit closest to the health challenges at hand, who understand the priorities and needs of their countries. And a lot of our work is what can we do to support you in your mission and your work? That leads us to that second principle around supporting that government-led transformation. And as you've seen through the work that we do, again, with civil society and nonprofits, really through collaborative ecosystem building. Within that, we aim to focus on under-resourced health systems and certainly underserved populations. And again, as that common refrain, we do try to meet partners where they are and provide support on their data journeys. And then that last is, we very much lead with that philosophy that data is a public good, but that in doing so, and particularly with health data, we recognize the sensitivity around this. And we recognize that we also need to maintain respect for data sovereignty and digital dignity. I know that was a whole host of information in a short amount of time. This, and I should hope to work, I'm happy to take one or two questions, mindful of time, but more than happy to connect and to continue learning with and alongside you. If you sort of scan this, that should take you to the LinkedIn page. If you want to continue the conversation, you may reach out or find more information about us here. But it was a real pleasure to be able to join you today. And thank you again for the time.
Thank you, Rebecca. It's a pleasure to have you with us virtually, though it would have been fantastic to have you here in person.
I know.
And we would like to take this opportunity to thank McGovern Foundation, you, Mr. Vilaster, the president, and Elizabeth McGovern, the trustee, and for your continuous support for the last several years now. And I would like to have Dr. Bunchai, our chair, and then Dr. Alvin Marcelo, our executive director, and then Dr. Fazila from the Ministry of Health, Malaysia, and then Anis from the Indonesia, and then we have Christine, our operations manager.
Hello.
Cha, our web manager, and then Jocelyn from the Malaysia Secretariat, and Vian, our accounts person, and Lukwar Pereya from the Thailand Secretariat. So we take this opportunity to thank McGovern Foundation for your support. Thank you very much.
Absolutely. Thank you all. It's truly our pleasure. We're so excited about the work that you're doing and wish you the best for these meetings ahead and look forward to participating virtually.
Actually, I would like to kind of give this opportunity to kind of thank the foundation. I remember 4 years ago that we met the founder of the foundation in a meeting in Winter Park, and we're talking about our community practice, and it's growing, and we are now getting more. You can see our community is growing, and we can do more on this. And thank you very much for the support from the last 2 or 3 years. Thank you.
Absolutely. Absolutely. It has been a true pleasure watching this grow. And I know I've only been on this journey with you for 16 months, but it's been a real pleasure. And I can feel that energy from the room, even in my little Zoom box. So I'm just so thrilled for what I know is going to be a really wonderful set of conversations this week. So thank you for all of the work that you all do.
Thank you, Rebecca. Bye.
Have a good day, everyone.
10 years of collaboration, and now we're really expanding with many more partners. And I like the idea of that culture of data use as the, the endpoint, which actually stimulates other things, the tools that we are talking about, the coming together of thought leaders and also communities in order to take advantage of um, the benefits of digital health.